Fundamentally, it goes back to the mission statement of Texas Children's Hospital, which is to be a healthcare leader in the global community for children and women in both education, research, and patient care. And then if you look at those three components, patient care, education, and research, Texas Children's has fundamentally been a leader in all of those.
A vaccine to me is one of the tools that we use as doctors against now a very, very deadly disease. For me, the vaccination is quite personal, it's quite familial, it's communal, and to a certain extent that is actually patriotic. For me personally, my brother actually and my brother-in-law had polio as children. And by the time I was born, that was a vaccine. But I saw them grow up with the devastating physical disabilities associated with that. So just from that experience, I was convinced that vaccinations are very powerful and a tool against a very awful disease. From a community perspective, my father was a soldier, and he taught me to protect myself, protect my family, and then furthermore, to protect my community. And those are the types of things that I'm trying to do in terms of the vaccination. I take the vaccination to protect myself. I take the vaccination to protect others. I take the vaccination as an inspiration for other people to want to do the same.
My mother, she's 72, she stays with us. My husband, he's a police officer as well, and so he has a lot of face time with the public. And so I felt personally I had a moral responsibility to do it for my family, and then also for my children, to show them that this is important and that we want to make sure that we keep ourselves safe for others. Professionally, the same thing. It was a moral obligation. As a nurse, I know that we are called to heal. We're called to take care of our patients. And now that I'm not at the bedside, I felt that this was my way to contribute to caring for our patients.
When people ask me why I took the vaccine, I emphasize I took it for me because of my health. I wanted to make sure I was protected. But I also took it for my family, my parents, my children. I took it for my co-workers because I want to protect them. I took it for my patients. We have to understand that many of them are not going to be able to get the vaccine for a while. And more important, I did it because I wanted to make sure that I contribute a small difference in ending this pandemic.
It was emotional for me to receive the COVID vaccine, just for the fact that of all the things that our family and friends have gone through this year, the things that they've struggled with, our emotional separations, our physical separations, just all those in one component. As soon as I got the shot, it was just a very emotional aspect. My kids asked me, do you ever cry? Do you ever get emotional? And then I think this one time I did feel a little bit of emotion.
Because as a child, my father was in the military, so I got a lot of vaccinations. And so actually I was quite afraid of shots. And I hated shots. I hated needles. And it's taken me a long time to get over that. So I guess you kind of saw a little look in my eye. I couldn't look at the needle going in my arm. It was kind of a sore spot. And indeed, I was brave enough to get over those fears and more mature enough to accept the fact that I needed this in order to do my job, and I needed this in order to protect my family.
It was a mixture of hope and happiness. I was just so happy that this time had finally come. I know a lot of work had been put into making the vaccine. It was anchored in science. The clinical trials were a golden standard clinical trial. And so I was just so happy to be a part of this wave, and then also hope for the future. We have missed out on a lot of things this year, and so getting the vaccine gave me hope that we are nearing the end. I've been a nurse a long time, and there are a lot of moments that stand out as being special moments, but there are few moments that stand out as being exceptional and stellar moments. And this is a moment such as that. I just felt such a sense of pride. I just feel like I work for the best organization in the world, and just to allow me to be a part of this effort, I just couldn't be more grateful.
It was very emotional. I was very happy to be one of the first ones to receive the vaccine and start the process. I know the vaccine is not going to end the pandemic in a matter of days or months, but it's the first step. So it was very emotional. I actually took a selfie because I wanted to share it with my family and my friends.
This year, 2020 especially, was the year of the nurse. So, it was very important as being in this field to know that we're at the forefront of that, and then we need to educate our community and our colleagues in the importance of getting vaccinated.
The virus itself has been controlling our lives. And there's another analogy is that, are you a hammer or are you a nail? Well, I'd like to see myself as being part of the hammer approach, and that is to be active against the disease. Protecting myself, social distancing, wearing PPE, those are things that we can do. But to actively eradicate the virus itself, we need something that eliminates it. And so it appeals to my soldier father mentality that this is a fight. And in order to win this fight, we've got to eliminate the enemy. And the enemy is the virus. So this is only one part of getting us back toward a normalcy that I long to have again. I want to be with my friends. I want to be with my family. I want to go to my church. This is one step in that process.
We've been impacted by COVID-19 in different ways, economically, personally, there are just in a rainbow of different ways we've been impacted. And when I think about 2021, I feel like people have hope, not just for a balanced and a more stable economy, but they'll get to see each other's smiles. They'll be able to hug. I personally miss traveling. And that's what I'm hopeful for. It's just that we get back to what our past normal lives were.
We know that the measures that we've been taking have helped us stop some of the spread. But the only way we're going to eliminate this pandemic is by getting vaccinated. And we need a large number of people to do that. So there is hope, and this vaccine is going to be the first step of a new beginning, and hopefully in a matter of a few months to maybe a year, things will go back to the new normal.
For those that are hesitant about getting the vaccine, it's important to do the research and educate yourself, but then also talk to those that are involved.
I have great confidence in the vaccine and the science behind it. I do believe that it will protect us from this disease, and it's one of the many things we have at our arsenal to get us back to normalcy.
I would emphasize that we know this is a safe vaccine. That's the reason why I got my shot. Actually, this morning, both my parents are getting their shot, and so it makes me very excited, and I would encourage everyone to read about it, understand that it's a safe vaccine, and that it's going to make a difference.